Well, odontomes are a group of common hamartomatous odontogenic lesions with a very limited growth potential. A hamartoma is mostly benign local malformation of cells that resembles a neoplasm of local tissue but is usually due to a overgrowth of multiple aberrant cells. So it's a benign, not cancerous growth which is made up of abnormal mixture of cells and tissues normally found in the area of the body where the growth occurs. These lesions are capable of producing normal appearing enamel, dentine, cementum, and pulp in an unorganized fashion. The tumor probably occurs during the development of teeth at a point after the stage of histodifferentiation but prior to the stage of morphodifferentiation, and this could be a very important entrance exam question. So, this enamel and dentine are usually laid down in an abnormal pattern because the organization of odontogenic cells fail to reach a normal state of morphodifferentiation. And this is also called, or this lesion is also called as the composite odontoma, as it is composed of more than one type of tissue. So, the composite odontoma can be of two types. The first one being the compound composite odontome. In this, the enamel and dentine are laid down in such a fashion that the structures bear considerable amount of resemblance to normal teeth, except that they are often smaller than the typical teeth. The second type is the complex composite odontome. Here is when the calcified dental tissues are simply an irregular mass bearing no morphological similarity even to the rudimentary teeth. The compound composite odontoma is far more common than the complex composite odontome, and these lesions are usually more common among children and young adults, mostly in the second decade of life. Now, both the sexes are equally affected, however, there might be a slight male predominance. Talking about the compound odontome, it usually is involved in the anterior part of the maxilla in the intercanine region, whereas the premolar molar region is involved in the mandible in the case of the complex composite odontome. The odontomes are generally small asymptomatic lesions which are detected incidentally. The lesions vary in size greatly and it can be as small as a tooth or it may be as large as 6 centimeters in diameter. In few cases, they may produce large bony hard swellings of the jaw with expansion of the cortical plates and displacement of the regional teeth. A tooth may often be missing from the dental arch as the odontome can block the eruption path of the tooth. And the lesions are often associated with an impacted tooth or a retained deciduous tooth. Well, odontomes usually produce pericoronal radiolucencies with well defined and well corticated borders. A developing odontome may look completely radiolucent as the calcified elements do not form in the initial stages. The compound odontome usually there is appearance of numerous small miniature teeth or tooth-like structures which are projecting from a single focus and they look like a bag of teeth appearance. Unlike that of the complex odontome, radiographically appear as oval or round sunburst like aggregated radiographic masses within the jaw. They do not produce any morphologically identifiable tooth or teeth like structures. And both the type of odontomes usually are surrounded by a thin radiolucent zone at the periphery which represents the capsule. Talking about the histological feature of the odontome, well, the appearance of odontome is not spectacular. One finds normal appearing enamel or enamel matrix, dentine pulp tissue, and cementum, which may or may not exhibit a normal relation to one another. If the morphological resemblance of teeth does exist, the structures are usually single rooted and the connective tissue capsule surrounding or around the odontome is similar to in all aspects to the follicle surrounding a normal tooth. Often, you might also see ghost cells similar to that of presenting in calcifying odontogenic cyst. And these ghost cells are those that have changed in a way without a nucleus but has been able to maintain its basic cell shape. Well, talking about the treatment, it is surgical enucleation and recurrence is very rare. When there is simultaneous occurrence of ameloblastoma and composite odontome, it is called as ameloblastic odontoma or odontoameloblastoma. For complete oral pathology lectures, you can visit and DM me on my Instagram page, that is Noor Saira Wajid. These are in depth lectures of oral pathology on oral medicine, along with thousands of fresh MCQs. Lectures and MCQs are made by aggregating information from various important sources, which will help you excel both in your university examinations and entrance examinations like those of Neet MDS and Aiims MDS. For more information, you can visit my Instagram page or DM me to have a chat. Have a good day. For more such videos, please like, share, follow, and subscribe my YouTube channel. You can also follow me on Instagram. Have a good day. Thank you.